Hi, everybody. Can you hear me all?
Yeah, hello, Mireille.
Okay, great. So I think it's the start of our webinar on strategy verification for strategic purchasing. First of all, thank you everybody to be here to listen our colleagues from Nigeria and Cameroon share their experience on verification. I am Mireille Ntchagang. I'm coordinating the collectivity working group on digital tools for strategic purchasing. I'm also a capacity strategy and community lead at Bluesquare. So some words about our group and who we are. So we formed the group with the idea of answering the burning question, which is how can we ensure that purchasing creates more value in terms of efficiency, equity, and quality than the cost of verification and fraud detection in the context of limited resources and affordability. So a group of collectivity experts active in health financing has been formed to reflect on the opportunities offered by digitalization to make the healthcare purchasing function more strategic. We formed that group late in June, September 2021. We started working groups, one on a conference, an international conference that we want to organize in order to reflect on the use of digital tools in the strategic purchasing, and another working group on webinars. So this is why you are here today. We really want to value the knowledge of practitioners to provide local and global responses to the challenge of purchasing, and in the conjunction with communities of practice, national and international institutions. So this webinar objective, the webinar aims at sharing country experiences, as I said, both in both in the PBF and the health insurance. You can also have access to the previous webinar we organized with Mali and Senegal late in April. So you will find the video recording on a Bluesquare YouTube channel, and also a summary, a text summary on a collectivity website. So we really want this session to be participative, so please address your question in the Q&A because the panelists won't have access to the chat. I want to end my introduction with being thanked to our supportive organization. So you all know P4H. Also, I think some of you know the COPs, the collectivity COP, the financial access to health services, and also the PBF, and also Bluesquare. Some words about the moderator, who is Maarten Oranje, a health financing and PBF expert, with a focus on the use of data for decision making. So Maarten works at Cordaid since 2014, with also a focus on the application of PBF. His country experience include Uganda, Zimbabwe, DRC, and CAR, and is currently working with the WHO Health Financing Department in order to contribute to the publication of paper on the use of digital technologies in the health financing. So I give you the micro, Maarten, and I hope you will enjoy the session. Thank you, everyone.
Thank you, Mireille, and good afternoon, everyone, or good morning, good evening, if you happen to be in another part of the world today. Can we go to the next slide, please? Yeah. So today, as Mireille already explained, we'll be talking about strategic verification as an instrument for strategic purchasing. We'll be hearing from 3 different speakers. So first of all, in a few minutes, we will listen to Grégoire Lurton from Bluesquare, who will give a keynote speech on the topic of today's webinar. And after that, we will have the country presentations, respectively from Cameroon and from Nigeria. I will introduce the speakers in due course. In between the different presentations, we will have some time to answer burning questions that might raise from the audience. And after the presentations, we still hope to have some time also for debate or questions that might still be up in the air by the end of today's webinar. So we'll hope to have some time for that. And then today also the webinar is supported by Ridhima Sodhi from the P4H Network, who will also help us in the Q&A session. With that being said, let's take a few minutes of time to make sure that we're all on the same page when we're talking about purchasing and about strategic purchasing. Of course, purchasing is an essential function of any health financing system. And one of the challenges that I think we all face in our work is to make purchasing more strategic in order to meet the objectives of universal health coverage of UHC. Next slide, please. So what do we mean by strategic purchasing? That's the only introduction that I'm going to be giving today. Strategic purchasing by the World Health Organization, it is defined as such. It means an active evidence-based engagement in defining the service mix and the volume and selecting the provider mix in order to maximize societal objectives. Well, that's a mouthful. That's a very information-dense definition. But of course, in other words, it means what to buy, which services to purchase, which services and which interventions, from whom to buy those services. So the choice, the selection of providers, and how to buy. So we talk about the design of the financial and the non-financial incentives. So very brief, strategic purchasing is a strategy to ensure value for money. And in order to be able to ensure value for money, of course, we need reliable data. And reliable data, they are crucial. Well, first of all, of course, in order to be able to pay providers in the first place. If you don't have reliable data, then what are you going to base your payment on? But second, reliable data are, of course, also very important to inform policy decisions, to make adaptations to existing programs, to make sure that we can actually make purchasing more strategic in the future. So strategic purchasing, that is, let's say, the end goal, the end objective that we're talking about. And today we're focusing on the question, how can verification contribute to strategic purchasing? How can we make that process of verification in health insurance schemes or in performance-based financing schemes? How can we make that process in itself more strategic? With that being said, I think we should now go to our first speaker, to the keynote speech, which will be presented to you by Grégoire Lurton. Grégoire is a specialist in health information system who currently leads the data science team at Bluesquare. At Bluesquare, Grégoire is also responsible for risk-based auditing activities for performance-based financing programs. He holds a master's degree in econometrics and quantitative economics, as well as a master's degree in development economics. And he's also currently a PhD candidate at the Institute of Health Metrics and Evaluation at the University of Washington. Grégoire has experience in supporting health information systems in 12 sub-Saharan African countries. Well, with that being said, let me give the floor to you, Grégoire.
Thanks, Maarten, and hi, everybody. Thanks for joining us this afternoon. And thanks for having me for these quick points I was asked to make to introduce the question of strategic verification. Maybe before jumping in some more advanced consideration, I wanted to take a step back and follow up on what Maarten has been introducing, to think about what verification he's doing within PBF and strategic purchasing. Here we see that verification is really intervening in the PBF process in 3 of the dimensions of PBF. First, it's around governance, where when verifications are being conducted. It's an occasion to train frontline workers, to do some strengthening of how PBF works and how PBF mechanisms are enforced. It's also a way to establish confidence and transparency about the data that is being used for payments, and to ensure that there is trust that payments are due and are based on data that is of good quality and that has been verified. Second, verification is, of course, used to guarantee that the data that is being used for strategic orientation is of good quality. And so that when strategic decisions, such as those that Maarten introduced a minute ago, are being based and evaluated on important and good quality data. And that's something that is important. And in case of weaknesses that are being identified, that these weaknesses can be managed and reinforced. Third, and maybe for most, verification is important for payments and to ensure that the payments that are being paid are being agreed upon, and that there is a strong basis to justify disbursements within PBF. So these being said, and with all those consideration about the different aspects that verification are filling in PBF systems, in some systems we see that verification costs are around can go until 30% of the overall cost of the PBF system. And so that's an important and costly function of the systems, and there are more and more discussions going around about how we could save on those costs and have more efficient and more strategic verifications being made during in the process. So first, what is verification about? And this is just a representation for people that haven't really thought about verification and haven't looked at it. But what you see here on the top of that slide is a representation of the whole verification process. That's data that comes from GRC, and you see that for different elements, for different services that are being performed by facilities, you have here claim values that is being made, and then the values that is being verified by verificators. And then you also have counter verification happening that allows to estimate how good the verification work is happening. The slightly postmodern graphs I've made and I put on just below is just to show how we can understand and what is this full process and how it is faring. Basically, what you're seeing here on the x-axis is a ratio of validation, meaning it's a ratio between the claimed value and the verified value. And so it tells you, how much of the claimed disbursements have been justified and have been validated after verification. On the y-axis and the vertical axis, you have the difference between the verification and the counter verification. It's a ratio again. It's counter verified divided by verified. And so what you see is when you're over one or when you're over one in each of those ratios, it means the verification or counter verification has led to an augmentation of the value. And when it's under one, it means you've been going under the value and you've diminished the claimed or the verified value. And what you can see is that in a province like the one on the left in Mongala here, we have a cloud of points and a distribution that is really on the left of the graph, meaning that in most cases verification have led to a diminution, a lowering of the claim of the value of the payments that are being made to facility. And that's something that happened in a very significant matter. But then once the verification happened, you see, we're on the line of the one, meaning there is, after counter verification, we don't have additional corrections that are being made. What do we learn here? We learn that verification is very important in that sense, because it allows to have a correction that is a good correction. It allows us to have a better payments being made to facilities. But then in North Kivu, when you go in the middle, what you see is that both verification and not verification are exactly on the line of one. So we're at the at the meeting point between those two lines, meaning that you don't have a lot of corrections happening either after verification or counter verification. what that means that a lot of verifications are made for nothing because there is no correction happening behind that. So we're just building trust here, but there is not a need or a systematic need to be going and trying to verify and validate data, because you don't need systematic corrections being made. And so that's a point where you think, we could do saving in that province. If you look at the third graph here, what you see is that we are on the left, meaning we are going down after verification, but we're also on the lower quarter, and which means that after counter verification, we're also going down and diminishing the values that are being invoiced. What that means is that in this situation, verification is happening, but it's not sufficient. It's not made properly. And so here we have an issue, which is to say, how could we make and how could we ensure that when verification happens, it's actually fulfilling its goal? Because here the cost of verification are really leading to results that are not satisfying in terms of building trust and also understanding better what the data is. Next slide, please. So when we talk about strategic verification, what is it that we want to make, and how do we want to use strategic verification to answer the questions and to better improve the way we do PBF? There are really two aspects of that, and that's what I mentioned in the first label here, is we want to answer specific questions, strategic questions that may be asked, and also control risks. And I'll talk a lot about controlling risk in the next slides. How it is that there are two ways we want to think about answering questions and controlling risks. First is we want to predict. We want to predict risks, profiles, and types of error in facilities. And we want to make sure that we are able to identify facilities or situations where we have systematic error happening, or systematic wrong data being reported, or even fraud, situations where fraud is happening. And we want to be able to predict that. We also want to be able to predict the financial risk of a PBF program. For example, if you have a lot of overspending, or if we have a risk of having huge variations of funding, we want to be able to predict that and to have sufficient information to be able to orient that. But we also want to monitor the probability that targets are going to be reached. And that's also, a way in which we want to look very closely at the data for verification. Is we want to make sure that the strategic objectives that are being defined by the strategic purchasing system are, have a chance of being reached, and that we are going in the right direction at that point. But the other perspective we may have is not a predictive one, meaning we're looking forward, but it's also reactive. And this is, we want really to very quickly being able to identify and investigate when we see unexpected results. And so we want to send a verification when we think, oh, this facility is reporting results that we think are weird or are not looking as they do usually. And we want to be able to capture that and orient an investigation. We also want to understand why we see facilities over or even underspending their funds, and we want to react to those situations. And we want to target strengthening activities showing low performance. So these may, be just some examples of things, or the type of questions we want to answer through verification. But first, the important point here is that we have two ways of thinking of how we want to use verification. First one is to have the predictive value of the strategic thinking, is we want to make sure that we're able to forecast what's happening in the future. And second, we want to be very reactive in terms of monitoring and managing the system and making sure that if anything is going wrong in some place, we're able to react to that very quickly. And those are two different objectives that we want to fulfill. Next. So what are the new opportunities for strategic verification? I won't go into the details of the picture on the right here, but really what I want to underline here is that for the past 5 or 10 years, there has been a huge increase in the availability of data for PBF, but also of verification data, meaning you have a lot of programs, of PBF programs that have been collected data, sending teams to verify the data into facilities. And this makes for a backlog of historical data that exists and that allows to understand the relationship between claim data, claim payment, and verified data. So that's really the crux of what I'm showing on the right here, is the ability to test and simulate different algorithms on verification and try to understand what would have happened in the past 5-10 years if we had used another way of doing verification rather than doing systematic verification, for example. And we're able to here use that data to think much more smartly and to have a much deeper understanding of what's happening during verification and how it can be improved and how it can be calibrated to really identify the problems and the issues we want to work with. And so there is a huge data analysis task that is now available and doable because this historical data exists in most countries. Also, we have new capabilities to enrich data and not only stick to the PBF data to think about verification, but we can compare PBF data with other data from other health systems, and we can do matching and merging of different data sources to be thinking about that and comparing results between different sources and triangulating data. We can add data from partners. We can integrate contextual data on rainfall, for example, on meteorological conditions, and see if we don't see any seasonal patterns of disease appearing, and we have a very strong rainfall season. That could be an idea to say, okay, we may want to check if that's actual what's happening, and do we have any issue in detecting malaria or other ailments. So here, and the new opportunities to think about strategic verification is really this availability and the techniques that can be applied to this new data that is made more and more available. Next. So, what are the main questions to consider? This being said, when we start now thinking about developing a strategic tool, developing an approach to strategic verification, how should we think about it? And that's based on the experience we have here at Bluesquare and on other projects we've led. I think the first thing is really to take the time to talk with partners in programs and to think, what is it we want to achieve with verification? What is the main goal of the verification? Is it governance? Is this really have a good understanding of the quality of the work that is being made, to make sure that we have a good monitoring of people in the field? Is it to have that type of verification and control? Or is it training? Do we want to target places where we think we have weak performances and we want to take an opportunity to train teams in the field? Or is it just management of the system? And do we want to make sure that we have regular points and regular visits to facilities and have a good handle on what's happening? And so having those are very different goals, and I think sometimes it's not always clear what it is we want to achieve through verification outside of just validating data. That's the first point that we need to clarify and to think through with different systems. Second is, what are the risks that we want to mitigate? And that's a key point. When we think and when we talk with people working in PBF, we identify a lot of different nature of risk. We have financial risk, that I already identified. I mean, we don't want to have to be overpaying, a huge amount of money because data is weak. But also we don't want to be spending too much money in verification. And so we want to mitigate the risk of having a budget for a PBF program that goes out of hand. Or we may want to mitigate, and that's not the same thing, we want to mitigate fraud, the risk of fraud, which is just people, having bad intentions, and that may not be the same as financial risk. That could have a fraud that is very minor in financial terms, but you want to address it in a systematic way, and so that's different. You won't be thinking about it at the same time. Or do you want to mitigate the risk of bad results and be here targeting facilities where you'll have issues in terms of performance, in terms of capacity, in terms of service provision, and that's a different thing that you'll be looking into. Okay, and so here, once you have made those decisions, once you have a clear sense of what it is you want to achieve through validation, through verification, what is the strategic goal that you want to address through verification, that's where you can start thinking about the best strategy to align those different efforts and to think in terms of algorithm of sampling strategies to be orienting your verification. Next. So there's also another question to think through. It is, what type of model do we want to use? I just, giving here visuals for 3 types of model that you may, have encountered in your practice. First is risk, putting facilities in categories of risks. That's an exercise that had been in Benin some time ago. You had facilities that were classified as red, orange, or green based on the level of risk, the level of financial amounts that was spent in facilities, and then based on those class of risks, you could have a different probability to be verified, and you had a sampling strategy that could be implemented based on those different aspects. Second, you could have what I call surveillance, but it's really a reactive approach to that approach, is to have an approach that is akin to epidemiological surveillance, where you want to identify situations that are going out of hand. So you're not, ex ante classifying facilities here, but you are much more trying to react to events that you are seeing, to data that is going out of hand and out of control as something you want to react to. But you have a third approach that is normative, which is more you want to compare facilities between each other and saying, oh, this facility has a profile that is very different from the others. It's having a lot of deliveries, but it's not doing any vaccination, for example, or this kind of things. And you want to have this kind of normative approach that allows us to compare facilities with each other. And you could just say, okay, I'm going to go verify facilities that don't look like the other, and I want to target those facilities. Next. So, as a an approach to that and a conclusion to my keynote here, I think the advice and very opinionated advice I would give to think about strategic verification is, first, as I already said, take the time to understand and describe what the programs want to achieve. So understand what are the risks that we want to be taking into account, what it is that we want to mitigate, what it is that the funders want to mitigate, talk with different policy makers, and also what are the priorities, what are the things that want to be acted upon. And second, differentiate risks. Why do I talk about differentiating risks? Is because we've seen in a lot of situations it's hard to have a discussion where we prioritize and we say, okay, we want to mitigate financial risk, and we don't care too much about or we want to worry a bit less about results risks, and risks may not be correlated or may be correlated in some situations, and so you can't really minimize all of them at the same time, and you have to make choices and to prioritize, and that's something that is hard to do, and it requires to have first a good understanding of how the risks interact with each other, and second, how it is that we can measure each of them and address them. Last, and that's I think the key point here, is to make a good approach and to make a good sampling strategy and to implement a good sampling strategy. What we want to be doing is also not think about pre-thinking and implementing the best system ever, but we want to think in iterative way, and maybe start with something that is very simple, very small, and then improve, evaluate, think about what you've been able to detect or not. Maybe have an approach where you have part of the of your verification that is completely at random, and another that is more strategically oriented. And very approaches and models come to webinars like the one today, where you hear from other experiences, and there is not one best way to think about it, and it's really about building approaches, understanding the priorities, understanding the data that we have, and building a technical approach progressively. I think that's my conclusion, and thank you very much for your attention. Looking forward for your questions.
Thank you very much, Grégoire. I think that was very informative and very interesting, and I think one really critical question that you're posing there, and which is, well, I dare to say, which is not always given the attention that is needed, is what exactly are you doing verification for? Why do you want to do verification? What is your main objective in doing verification? It seems very obvious, you want to reduce data discrepancies, but which ones are important? Is it about fraud? Is it about financial risk? Is it about just getting the data right? Because in that case, you also want to get the discrepancies of 1 and 2 right, whether it's 17 or 18, which is not necessarily the case if you're just focusing on fraud. I think that was very informative. I'm seeing that I think we have a question that's coming in through the chat. I would invite everyone, if you have a question, please do so through the Q&A functionality of this webinar, because that's where we are going to be monitoring the questions. So if there are any specific questions at this point in time, I think there is a question. Okay, this is one exception that I'm making. I'm now reading it from the chat, but from now on, please do it through the Q&A. There is a question from Dofore Guo Soro, which reads, if you could please elaborate the surveillance and the normative aspects while setting the objectives of verification. I'm not sure if the question is fully clear to you now. Otherwise, we could perhaps ask the participant to clarify the question. But this is a question that we have based on your presentation.
Yes, I think I can address, you know, the crux of it. I don't know if we could come back 2 slides ahead. Sorry, 2 slides back, Mireille. That's something you can do. Oops, no.
Sorry. No.
No, one more. Yeah. Okay. Here we are. Yeah. So this you know, relates to these slides, and yeah, I realize that, you know, the two. What I want to show here are different approaches and how to think and to differentiate different way to think about how we could, you know, set or create an algorithm for verification. So, for example, if I think about the surveillance approach and to be, you know, more specific about how that presents, I want to say, okay, there is a type of event that could happen in the data that I don't want to miss. For example, I have a financial amount being claimed by a facility that is multiplied by a factor of 3. That's something I really want to investigate directly. Or there is a financial amount that is being claimed for one specific type of service. That's something I want to investigate directly. Or that's something that is more linked to, you know, an AP situation. I have a number of cases of substances, or I have a diminution in number of prestation for vaccination that is being divided by 5, and that's something I want to go. And so what's happening here, you have to set 2 or 3 things. First is to set up, you know, look at the data that you have and identify what it is you're going to monitor with sufficient quality. Second is to specify what the thresholds are and what it is that we want to measure. Is it a doubling, dividing by 3? Could be, you know, you could have other ways to measure and to put together what you are going to be looking at, but you want to have, you know, what is the limit that you don't want your system or your facilities to get out of. And then there is a reaction rule, and you have to say, okay, when my facility is being is doubling the amount of money it's claiming for deliveries from one month to the other, if I take this example, then I'll be automatically sending a supervision or a verification effort in that situation, and we'll be focusing on looking at what's happening on the data for deliveries, or I'll be having a couple of activities I want to make specifically linked to that. And so surveillance and the approach that I call surveillance is being reactive to the data and paying close attention, but also making sure you know what it is you want to react to, and having that thought previously. I mentioned some time ago, you know, you have some historical data that you may want to look at to say, you know, what are the normal type of variation I'm seeing, and so what is abnormal, what is pathological type of variation that I want to react to, and I want to think, okay, what's behind that? When I talk about normative, it's really about comparing different facilities between each other. And so here you say, okay, I have facilities where I have, let's say, if I'm talking about the share of some types of services in the overall budget of the facilities. If I'm taking, you know, a PBF example, I'm saying, okay, most facilities, I would say half of their budget, or it's probably the wrong order of magnitude, but half or 75% of their budget is spent on primary health services, and then 25% is being spent on other types of services. But in some facilities, it's reverse, and it's comparable facilities. And so this is something I may want to be investigating. I have a facility that should look like the other, but doesn't look like the other. It looks like they are doing things differently. Is it because data is wrong? Is it because there is something specific happening in this facility where you have a specific type of population they need to serve? And so I want to be strategic about it. I want to adapt my packet of services to that facility that doesn't look like the other. Or is it because you have fabrication and it's very hard to fake, you know, data convincingly? And so if I have facilities that looks drastically like different from the other, that might be because I have something happening in the way the data has been made. And so it's very different to say, okay, I want to react to something that is happening first, surveillance, or I want to make sure that facilities that should look the same actually look the same, or I want to understand where the difference comes from. And that's another type of approach of algorithm and of way of thinking about the data that you'll be implementing there. Hope I answered the question.
Okay, thank you, Grégoire. I'm seeing more questions now coming in through the Q&A. I suggest that we take one more now, and then we will continue with the first country presentation, and any remaining questions, we either try to answer them in the debate at the end of this webinar, or we will answer them after the webinar if they are still outstanding. Yeah, so I will take one more question for this person. I think there's one question which is a general question. Of course, the slides of this webinar they will be shared afterwards. So that's a general question. Then there is another question which is asking what type of model you used to make the graphs to relate the verification and the counter verification outcomes. You know, the three graphs that we saw in the beginning of your presentation. So what kind of model or algorithm did you use to make those graphs? You're still on mute, Grégoire.
Yes, thank you. Yeah, actually, there is no model related to that. It's really purely descriptive, but the technical work behind that has been one of reconciliation, meaning merging the different data from verification and counter verification and putting them together. And then the only modeling that's happening is just doing the ratios that have been showing. So divided verified value divided by claim value, and then counter verified divided by verified. And then I would say the most technical part is really finding a good way to represent data that is actually data elements by facility, by round of verification and counter verification on one single graph. And so that's why I've been representing that using those level lines, the density of the data to make sure that I can show what the distribution, this bidimensional distribution looks like. But there is very really no actual modeling about it. It's just linear combination of some data elements and then some representation on the graph. And maybe just to add, you can keep questions coming through the Q&A, and I'll try to answer in writing if there are questions coming later on.
Okay, thank you so much, Grégoire. So, and then I think it's time to continue with the first of our country presentations. So in the previous webinar, we've listened to the actual verification processes and the actual experiences in countries Senegal and Mali. And today, the first country from which we'll be hearing is Cameroon. So these two presentations that we will now be listening to, they're really about, okay, how is verification currently being done? What are the challenges? What are possible solutions for the verification practice? Our first speaker today is Nji Valéry CHE. Nji Valéry is a health system strengthening specialist with over 8 years of experience in results-based financing, design and implementation, both in Cameroon and in Nigeria. He holds a master's degree in public health, and he is currently a final year PhD candidate at Texila American University. He has served as a technical advisor with Oxford Policy Management and the National Primary Healthcare Development Agency in Nigeria, supporting the implementation of results-based financing in Nigeria. And in Cameroon, he has worked with ADES Iresco also as a PBF data manager. Valéry today will speak about the practice from his experience in Cameroon. Okay, very pleased to have you. And then I'll give the floor to Valéry.
Okay, thank you very much, Maarten, for that introduction. Like you said, my name is Nji Valéry CHE. I'll be presenting for Cameroon. So I'll be presenting on strategic verification for strategic purchasing, the experiences from Cameroon. For this presentation, we are going to have the following outline slide. Yes, so for looking at the demography of the country in 2021, the country had a population of about 27 million inhabitants slide, and we have the other demographic profile as a projected slide. So in Cameroon, we have different health financing schemes that exist. We have subsidized healthcare, we have performance-based financing program, we have mutual health organizations, we have the voucher program, private health insurance, the national health insurance scheme, and we have out-of-pocket expenditure. So we see that out of these 7 schemes, out-of-pocket expenditure really accounts for 72% of the total health expenditure in the country. So for this presentation, I would be focusing on a performance-based financing slide. So looking at the verification mechanism in Cameroon, we have quantity verification, we have quarterly quality assessment, we have quarterly community verification, which is also called community client satisfaction survey. So for the quantity verification, it is done by the contract management and verification agency, and this is done on a monthly basis by verifiers from this agency who use declaration validation forms and do verification at the level of the health facility. So it is important to note here that at the end of the verification process in the health facility manager and the verifier, they co-sign the declaration validation form. Then one thing that they also use when they are doing verification on the field to avoid arguments on the field, they go down to the field with service protocols that they use, so that if they have some issues with verification of a particular indicator, especially coming from the facility manager, they can be able to explain that using that service protocol as a reference. So at the end of this verification, you would have the declaration validation form that gives the monthly production of the health facility. Then we have a quarterly quality assessment. This quarterly quality assessment is actually done by the district medical teams for the minimum package of activity contracts. And for the complementary package of activity contracts, this is done by the peers from the various hospitals implementing performance-based financing in the region, which have been constituted by the regional delegation of public health. So the evaluation team that goes down to the health facilities use a quality assessment checklist. At the end of the quality assessment, the evaluators, the evaluation team signs the quality checklist together with the director of the hospital or the health facility manager. So on the quality checklist, you would have the quality score of the health facility at the end of the process. Now we have community verification. Community verification actually happens at the level of the communities. So community verification is done by CBOs. So the CBOs verifiers at the level of the health facility, they'll sample some clients for some services and they'll fill out so they do this using the sampling forms, and they'll fill out the section A of the questionnaire that they have to give to the CBOs to go to the field. So they'll just fill the identification information, the information that the CBOs will use to identify the clients on the field. So the CBOs now take these questionnaires to the field and they trace these patients to see if these patients actually exist and they receive health services at the level of the health facility. So at the end of this process, the data that comes from the questionnaires is being entered into a database that leads up to the quality, that leads up to the community verification score for the health facility. So one lesson that we've been able to learn from this community verification is that the feedback that comes from this process is being given back to the health facility, and the health facility has to incorporate it into the business plan for the next quarter so that they can use to improve. Slide. So it's important to also note that within the verification framework in Cameroon, which is actually done by the Contract Management Verification Agency, this agency also plays the role of an IVA, of an independent verification agency. So the CMVA systematically does verification for all health facilities that are implementing performance-based financing. Then the data manager of the CMVA usually observes the indicators for outliers, and these will actually inform maybe counter verification. Then when there is a suspected collusion between the health facility and the verifier, there is also counter verification that is done, and routinely counter verification is done to check the work of the verifier. Slide. Now we will, in the PBF design in Cameroon, the final quality score of the health facility is made up of 35% of the community verification score, 35% of the quality assessment score that was done at the level of the health facilities, and 30% use of the indices too. So you realize that at the level of the districts, we have the district validation committee that meets every quarter to validate the invoices, the production and the invoices for all the health facilities within the district. So before this happens, the verifier at the level of the agency downloads the quarterly invoice for all the health facilities in a particular district, for the district that he or she is covering. And together with the monthly productions of the health facility, he takes this down to the district validation meeting. At the end of the district validation meeting, when all of this has been approved, he returns back with the signed invoices, and these invoices are consolidated for all the implementing districts in the region, and they are sent to the National Technical Units for PBF implementation for payment of subsidies to the health facilities. So subsidies are paid to the accounts of the Contract Management Verification Agency, and in turn, these subsidies are now transferred to the individual health facilities implementing the project. Slide. So we have some best practices of verification that I will just highlight here. One of the best practices is the use of this service protocol during verification that has been able to really clear a lot of doubts in situations where a health facility manager is trying to argue with the verifier that a particular indicator was not proper.
It seems we're losing the connection there.
It's not me. Okay.
It has helped to reduce over-reporting and at the same time also reducing under-reporting. Then we have sanctions to health facilities against fraud. This has actually helped to reduce, fraud at the level of the health facilities. We also want to think that one of the best practices of verification is the contracts which is being signed between the CMVA and the health facility and the various implementing health facilities that has really that defines the service packages that these health facilities have to declare. Then we also have the declaration validation form, which is co-signed by the verifier and the health facility manager, actually validating what the facility, what the verifier has been able to do. Slide, please. So we also have some benefits of verification. Verification has actually helped to improve the data that is reported on the National Health Management Information System at the level of the health facility. Then we see that this verified data is used right at the level of the health facility in making decisions like development of the business plan of the health facility. And this verified data is also used at the regional and national levels. So with this verification, we see that verification has been able to create a system where there's a lot of trust and there's a lot of transparency in the data that is being reported. Slide. Yeah, so some of the challenges of verification, we have fraud. Fraud actually mutates in PBF because there are some unscrupulous health facility managers who really want to still do fraud even when they have been caught. So we think that that's one of the challenges. Then we also have poor documentation where most of the health facility managers, they don't really, the consulting nurses and doctors don't really take time to fill the various column headers in the registers that they use at all of the health facilities. Then we also, but this has been able to improve with coaching and mentoring from the verifiers. Then we also have situations where there is counting from serial numbers in the registers rather than counting the actual patients. Most of the data managers of the health facilities account from the serial numbers. Then we have poor storage of registers, the HMIS registers at the health facilities. You go to some health facilities, you see that these registers, some of them are torn, but this is also improving with coaching and mentoring from the verifiers. Then no review of invoice after compilation of claim by the health facility managers because of too much workload. They don't really take time to go through what the data manager has been able to compile at the end of the month. So you find some errors. Slide, please. Okay, so currently so now we want to look at the perspective of strategic verification for strategic purchasing. And currently in the country, in the east region of the country, we have a pilot study which is underway. And this study is to computerize the management information systems at the level of the health facility. So we want to think that if this eventually happens, we are suggesting for interoperability between the National Health Information System and the Open RBF portal, because the Open RBF portal does a lot of things. It generates consolidated invoices for the various health districts implementing PBF. It generates trend curves of quantity and quality, which the National Health Management Information System may not be able to do. We also want to suggest the use of smartphones at the level of the health facility for verification, because with these smartphones, you have applications installed like the Open Data Kit, which will actually indicate with the GPS in place, you actually indicate if verification was done at the health facility. Then at the policy level, we want to suggest that there should be routine monitoring of indicator coverages at the level of the CTN, and this will be, and once this is done and we realize that most of these indicators have attained their coverages, then the funds for these indicators or the unit fees of these indicators now can be directed to poorly performing indicators, so that you can also have, this will help to improve on strategic purchasing. Then we are also suggesting risk-based verification, where health facilities can be categorized according to level of risk, low, medium, and high risk. Those high risk health facilities, now verification could be done for those health facilities on a regular basis, while for the medium and low risk health facilities, just periodic verification can be done, and this will help to reduce on the verification cost, which was highlighted by Lurton a while ago. Slide. So we want to think that with digitalization of the strategic verification process, this will really help to enhance strategic purchasing and will also increase value for money within strategic purchasing. So thank you very much for your kind attention. I'm open for questions and responses. Thank you very much.
Okay, thank you very much, Valéry. I think you've really brought us up to date with how PBF and how verification functions in Cameroon, some of the challenges that you're facing there, and some of the ideas that are currently on the table, how those challenges could be addressed. We will now first be taking some questions about your presentation before continuing to the next presentation about Nigeria. And for that, I will hand over to Ridhima Sodhi, but not after first having introduced her. So Ridhima is an economist, a data scientist, and a policy professional with experience working and collaborating with academic, governmental, public, and private organizations. And currently, she is engaged with the P4H Network at the World Health Organization and supports their work on health financing and on data. Ridhima has an MA degree in economics and a Master of Science degree in public policy, and is also a former associate research scientist at the New York University. With that, let me give the floor to you, Ridhima.
Thanks, Maarten, and thanks, Valéry, for this very, very interesting experience and presentation. And we already have, more than a couple of exciting, interesting questions. So I'll club two of them. So the attendees are asking that, based on your experience of working with the PBF system in Cameroon, what are the challenges you have faced? And also, can you also mention a little bit about what measures you have taken to make this process more sustainable? Because that is the #1 challenge in other countries as well.
Yes, I think, like I mentioned in the presentation, I think one of the major challenges is fraud with PBF implementation in country at level of the health facilities, because the health facilities know that when they have huge data, that is also going to correspond to a lot of subsidies coming to the health facilities. So within the PBF design and in the contract of the health facility, there are sanctions for fraud. There are very strict sanctions of fraud which are applied for all health facilities that are actually caught in fraud. Then to the next part of the question, which is talking about sustainability, I think the major issue about PBF is sustainability in most of the countries because like in Cameroon, PBF is funded by the World Bank, but we want to think that there is the Ministry of Finance. I think like in the littoral region, you know, the payments now made to the health facilities in the littoral region are coming. That is this region actually. So the payments actually come from the central technical unit and goes to the health facilities, but the health facilities really have to respect the health facility. So what I want to say here is that there is gradual uptake of PBF by the government within the country. So we really want to think that we have to really press again at the national level. The national level is really doing a lot to see that the government really incorporates this aspect of this mechanism, gradually takes it up, especially when funding from the World Bank really dwindles. So I think that is what is happening within the country now.
So thanks, Valéry. So what I'm trying to rephrase what you just said is that we are scaling the utilization of this mechanism across the country, and also to ensure that there is less fraud. The mechanism ensures that the penalty for having been caught doing something fraudulently is pretty high, and that is sort of contributing to the success of this particular program.
I didn't get the question clearly, please.
Okay. I was saying that you mentioned initially that the penalty within the mechanism, within the process for someone or some agency or some individual to conduct fraud is pretty high up, which ensures that the fraud is, which puts a limit to the fraud.
Yes, I think so. Like I mentioned a while ago, within the contracts of the health facility with the Contract Management and Verification Agency, there are sanctions, very strict sanctions of fraud. And when fraud happens a number of times, the health facility is eventually suspended from the project. So we really have very strict sanctions of fraud, and with coaching and mentoring from the verifiers, because there's a lot of coaching and mentoring that is being done by the verifiers at the level of the health facilities. So with this coaching and mentoring, you don't really have those cases of fraud really coming up. But with the gradual scale up of this intervention in the country, those health facilities that are coming new on board, whenever they join the project, they really want to tend to do fraud. But I think once they are caught the first time, and with coaching and mentoring, you see that it is actually being reduced. So this fraud is there's actually a reduction in this fraud. Then if you look at the service package in Cameroon, you see that all the indicators have error margins, and these error margins are also there to penalize particular indicators where there is over-reporting, especially when there is fraud and when there is also under-reporting, because we want to ensure that the data that is reported by or that is declared by the health facility is actually consistent with what is verified by the verifiers when they go to the field on a monthly basis.
Thanks, Valéry. There are many more questions, but I'll just take one to account for the time. Is that there is a question? There are two questions around the costing in percentage or in absolute terms. If you can sort of mention, shed a little bit of light over there.
Yes, I think with most of the like in Cameroon, if you look at the cost of verification in Cameroon is between 15 to 30% of the overall PBF budget, and this is actually what is recommended for most PBF schemes. But you see, the point here is that some persons still think that this cost of verification is still high. That is high. That's why you see towards the end, when I was talking about the perspective, I was suggesting risk-based verification, because in Cameroon, verification is done for all health facilities on a monthly basis. Those PBF implementing health facilities for all of them on a monthly basis. But now, if we are doing a risk-based verification where health facilities are categorized, we have the low, the low risk health facilities, the medium risk health facilities, and the high risk health facilities. Those high risk health facilities can actually be verified more frequently, while the medium and low risk health facilities can be verified on a quarterly basis, and this can actually help to reduce the overall cost of verification.
Okay, thank you so much, Valerie. We will take any other questions towards the end. Floor to Maarten.
Okay.
Thank you, Ridhima, and thank you, Valerie. With that, let us move to the last presentation of today. And for that, we invite Faruk Yahaya from Nigeria. Faruk has an advanced diploma in public health and health promotion and a master's in health economics. He's an experienced PBF verifier in Nigeria and also a technical assistant. He has been for the Nigeria State Health Investment Project in Nasarawa and Northeast Taraba State. He has worked with the Nasarawa state government, with Oxford Policy Management, with the Health Strategy and Delivery Foundation, and currently he works as a freelancer, specifically in the field of results-based monitoring and evaluation. So Faruk will speak from his experience in PBF on Nigeria. Okay, the floor is yours, Faruk.
Well, good afternoon, good evening, and good morning, everyone.
Okay, can I ask everyone to mute their mics?
Right. Yeah, hello, I'm sorry. Right, I'm going to be talking about my experience from Nigeria, looking at the overview of the Nigerian fragmented health system and financing scheme. Then we'll be looking at the verification and performance-based financing in Nigeria, and then the basic healthcare provision fund, which was developed from the experiences of PBF and DFF. Next slide, please. Yes, we have certain fragmented health financing schemes, which are the National Health Insurance Scheme with the 20% coverage of civil servants, private health insurance, the recently launched community health insurance, out-of-pocket payments, deficit financing, which was used to fund for COVID-19, tax-based revenue from government, input financing, and then donor funding in the context of the World Bank financed performance-based financing project. Next slide, please. Good. Here, looking at what here, this is just to let you understand that the PBF was conceived in 2011. I was implemented under the context of the Nigerian State Health Investment Project. And then the idea of the project was to test for the effectiveness of result-based financing using PBF and DFF in comparison to see how it can have an effect on our infrastructure and to reduce drug drought and to strengthen the health system, with verification at the cornerstone of the PBF project. Next slide, please. Yeah, this slide is looking at verification in Nigeria. We have basically two forms of verification, for quality and for quantity. And then the quantity verification is done monthly, while the quality verification is done also at the end of the quarter. Then a counter verification for the quality is done 2 weeks after the initial quality assessment by the primary healthcare department, while the counter verification, that is community client satisfaction survey, is done at the end of the quarter by a contracted firm, independent verification agents. Next slide, please. So these are the benefits of the PBF and the course of the implementation. It brought about improved governance and accountability, promotes the inclusion of the community and strengthen the community voice in the participation, and then also brought about collaboration between policy makers at various sectors in the course of the implementation. And another point, its data quality was improved through digitization, because the Nigerian government contracted the Bluesquare to actually develop the open data kit, which was tried to be synchronized with the DHIS2 in order to ensure effective data upload from the facilities to on the electronic dashboard. Next slide, please. And the cost of based on the experiences of the PBF and DFF, and because of the implementation, because initially we talked about the idea was to test the effectiveness of PBF and DFF. In the course of the implementation, the Nigerian government realized that after the impact evaluation, realized that decentralized facility financing was more effective in the Nigerian context than PBF. To that, the Nigerian government developed the Basic Healthcare Provision Fund, which the financing using the decentralized facility provider payment mechanism was modified to form the payment scheme for Basic Healthcare Provision Fund. The idea is to make funding available for primary healthcare and then to fund for basic medical emergencies and to treat for public health emergencies. Next slide, please. So this is verification in Basic Healthcare Provision Fund is from the providers at the end of the month submit their monthly claims for verification. After verification by the state verifiers, it has been also assessed by the third-party agents to find out if truly persons who were claimed to have access healthcare service in these facilities do exist. And then a technical working group sits to make approval based on the verification that has been done to onward delivery to the Central Bank of Nigeria, which ensures payments at the end of the quarter to these health facilities. So what is very important here is that 15% of the utilized services provided by these health facilities are verified using phone calls to find out if these persons who were claimed to have access to these services do exist. And at the end of the day, if less than 25% of those verified have proven not to exist, then there's a retention of the 25% of the expected earnings of those facilities. Next slide, please. Good. Here, this slide is looking at the comparison based on the lessons learned from PBF to the now Basic Healthcare Provision Fund. In PBF, there's a defined indicators to services to be rendered, while in Basic Healthcare Provision Fund, it's all about coverage. So there's not really a definite definition to certain services. And then remuneration is based on the quality of services that has been rendered in PBF, while in Basic Healthcare Provision Fund, we are looking at coverage, basically. So with the belief that health workers and the health centers will be able to provide quality healthcare service. Then lastly, there's a verification guideline in PBF, while for Basic Healthcare Provision Fund, at the moment, there's no verification guidelines, just as which is more detailed in PBF as it is in Basic Healthcare Provision. Next slide, please. Here, the basic challenges is issue of fraud. Fraud is very eminent where services are tied to finances. So fraud has always been a recurrent issue, even with the experiences with PBF. There's a lack of flexibility with the DHIS2, and innovative tools, digital tools that have been developed, for example, the Open Data Kit. And then there's no definite strategy for verification as a program, so to say, a national for the country itself, to say, this is the kind of verification that we want our healthcare services to go through. So it is usually defined by the donors. And then the next point there, looking at poor recording in health facilities has been a challenge. Next slide, please. Yeah, this slide is also just to add to the previous slide we just looked at, looking at improving data quality, designing and applying sanctions for prosecution for frauds. Next slide, please. So in conclusion, verification isn't a national strategy tool embedded in the Nigerian health system, but could be pushed needed to strengthen the quality of data to inform strategic position in a bid to harmonize the already fragmented health system. And again, verification have been utilized in PBF and DFF projects from which the Basic Healthcare Provision Fund was developed, and could really be a game changer because a lot have been learned, and that is what led to the government developing its own healthcare strategy in the bid to achieve the universal healthcare coverage. This presentation is also developed from the experiences of Basic Healthcare Provision Fund. However, I want to leave us with a question which we can review together. How can verification be embedded in national health guidelines to be utilized by INGOs or multilateral organizations that bring in funding to improve financing and strategic position for healthcare? Thank you for listening.
Okay, thank you, Faruk, for explaining us the situation in Nigeria. In summary, I think what the most important message that I'm taking from your presentation is that we previously had a performance-based financing scheme in Nigeria with quite strict verification guidelines for cases to be considered verified and validated. But then the PBF scheme, it was succeeded by the Basic Healthcare Provision Fund, which actually has different verification guidelines, a lighter verification process. And if I'm understanding you correctly, your plea is actually that the health system would benefit from going back to those stricter verification guidelines and those definitions that were in place on the PBF when it was implemented. Is that
Exactly.
That is a correct conclusion? Okay, that is
Yes.
I think a very interesting case because it's different from the situation, of course, of Cameroon, where the performance-based financing program is currently still ongoing. I think in listening to your presentation, we might have skipped a few points in the slide that was on the recommendations. So that was not the last slide, but I think the one before that. So maybe if I could ask Mireille to go back to the slide with the recommendations, and you could still help us to explain what kind of actions you would recommend now for the situation to improve. Faruk.
Yeah, all right. Thank you so much. Yeah, I'm sorry we had a little challenge because we made some adjustments lately. So, and the heading was supposed to be recommendations for verification, not a challenge here. Well, thank you, Mr. Maarten. Yeah, the idea is these recommendations were developed based on the challenges like you talked about. And the thing is, I'm not saying entirely that the verification in Basic Healthcare Provision Fund is not as effective. But the thing is, I understand where the government is coming from by keeping to looking at coverage rather than strict verification. Because when you look at from the first slide while I was looking at the financing scheme, you understand that out of pocket is quite a huge percentage of persons who come to utilize healthcare services. So in the bid to increase coverage, in the bid to make people access primary healthcare centers, I believe from the experiences of PBF and decentralized facility financing, which were two different concepts, they saw that the DFF, there's no verification at all, but then they rendered more services were validated, more services were uploaded on the DHIS2, compared to PBF, where they render services based on quality, and they take their time to render those services based on quality. To that, they have less coverage. So I believe that is that. But coming back to this slide, I was looking at if we're able to design and apply sanctions in the prosecution of fraud, it will go a long way to improve the quality of our data. And then improve when we're able to put important measures in improving the quality of this data itself, will detect fraud. Now, this is like leveraging on the slides presented by the TA from Bluesquare. I think he talked about something similar, but in a more technical term. And then interoperability of the DHIS2 with other innovative technology, like the Open Data Kit, will go a long way in also strengthening verification and then improving the quality of data too. And then if we're able to put in place defined rules for INGOs when they come in, or multilateral organizations when they come in with funding for our health programs, it will forestall this fragmentation and then duplication of health programs, because we have more than 3 organizations in Nigeria. All of them are working towards maternal and child health using different data, using different verification tools. So these health centers are overwhelmed too. So that also affects the quality of data that is coming out of this health facility. Thank you.
Okay, thank you, Faruk, for that addition. And with that, I can imagine that we also have some questions on this presentation. So with that, I will give the floor again to Ridhima for the Q&A.
Thanks, Maarten, and thanks, Faruk, for the wonderful presentation and also answering one of the many questions. There are a few questions which we can ask all of the panelists over here, but one is specific to Faruk, is that I need to know more about the use of phone calls for benefits verification. So perhaps do you have experience in the using phone calls for verifying benefits, Faruk? Do you want to respond to this question?
Okay. Yes, it's quite interesting. We have I told you I was a verifier too. So sometimes we render technical assistance to the community during the implementation of the community client satisfaction survey, that is third-party assessments, where the IVAs are given information of these clients who come to access services in the health facilities to find out if they really existed or they attend the facilities. So the idea is for every patient who comes to the health center, he registers his name, his address, and his phone number. So many a times when you go to these same addresses, you don't meet these clients. So you put a phone call through using certain protocols to put the person at ease, to let him understand where you are coming from and why you are putting a phone call through. And then you set an appointment to meet that person. But the idea of the government trying to relying on only phone calls here is to also save cost of transportation, because I told you they are learning from the experiences of PBF and DFF. What is quite expensive paying for verification, because as verifiers, your salaries is there, allowances are there, and then you travel, you spend, for example, 10,000 naira to go to a facility in hinterland. And then when you verify the services in the health facility, you see that the facility has only made 20,000 naira. So you can imagine the loss. You're spending 10,000 naira to visit a facility to verify its services, and it's producing services worth value of 20,000 naira. So I believe they are looking at cost there. But as the project, as the strategy progresses, there will be ideas will come on board. There will be more modified strategies to see how to overcome that or to perfect the idea behind the phone call too. Thank you.
Thanks, Faruk. There's another question which says that one of the reasons for fraud can be delayed payments. Have you seen such a problem in your experience working in Nigeria?
Yeah, the issues about fraud is quite imminent when it has to do with money. And when you look at, and I believe it was one of the basic issues that led to the failure of PBF in Nigeria, because even as verifiers, we write our report at the end of the month. I know we had that experiences of health workers in collusion with even authorities at local levels. You get to siphon funds. So I believe a part of the measure is to see that is why the government is using the Central Bank of Nigeria and then insisting that they are not going to work with ad hoc staffs. With PBF, facilities are allowed to hire ad hoc staffs, and most of those atrocities have been committed by these ad hoc staffs. So basically now it is about civil servants. So even when you steal money, you'll be able to pay when a investigation has been made, you pay to your salaries and or from your pensions. So it is quite it's quite strict with the basic healthcare provision fund. But however, fraud has been it was an issue. It was quite an issue that led to the failure of PBF in the Nigerian context, because subsidies are being paid for, while in DFF subsidies are not paid for. So those are the little. That is basically the thing.
Thanks. Thanks, Faruk. I think the question, I mean, while many attendees agree with your experience, but the question specifically was asking if the problem of delayed payments, wherein the payment is not made on time to a particular supplier, does that cause fraud in any way? Have you experienced something like that?
Okay. Now, for delayed payments, I know we had experiences like that with health facilities, but then while I know that during the implementation, we thought down how to forecast, leveraging on developing an effective a financial statement. So they are expected to save money from inception that has been designed for them on their financial plan. They have monies they save, and they are expected to save enough to be able to pay their contracted staffs even before their own basic payments for subsidies comes in. So the issue of delayed payments is really not the reason for fraud. Basically, humans have intentions to be greedy, and I believe that was basically what set in.
Okay, all right. Thank you. Thank you so much, Faruk. And with that, I'll close my questions for you. But there's one question which has repeatedly come up in all the three presentations. And the question is around utilizing digital methods for supporting PBF. And I can ask Grégoire or Valéry, whoever wants to answer that question, if in your experience, in your competence, if you can say that utilizing digital tools has in fact reduced the cost and increased efficiency for strategic purchasing. And I please request you to be a little bit quick, because we only have 6 minutes left. Okay, Valéry wants to say something.
Yes, okay, I'll take the context of Nigeria, where the system was, where we had the DHIS2 platform that was initiated towards the end of the project. And with this, you discover that health facilities could actually do reporting right from the health facility, so they did not have to fill out hard copies of declaration validation forms, sent to the contract management and verification agency before the verifier picks it up from there and goes back to the health facility. So there was real-time data entry at the level of the health facility, so the verifier now could only just download this at the level of the agency and take it down to the health facility. So
okay, yeah. Thanks, Valéry. So in the interest of time, because there is some audio challenge, I will invite Nigel James, because he has or she has been raising their hands since a very, very long time. And then I will give the floor to Maarten to conclude.
Training of health facility managers and all of that.
Nigel, do you want to say something? You've raised your hand. Okay. Perhaps not.
Sorry, there was.
No worries, Valéry. No worries. Okay, so we have no raised hands. Valéry, why don't you conclude, and then Maarten can conclude.
Yes, so I think there was a break in my connection, sorry. So yes, so I want to say that when this process is actually digitalized, it can actually make strategic purchasing very effective, and the cost of verification too can actually be reduced when this is accompanied by risk-based verification. Risk-based verification where you don't do verification for all the health facilities at the same time. No, you just do verification only for those high-risk health facilities. So this will actually help to reduce the cost, and you have real-time data at all levels.
Thanks, Valéry. Over to you, Maarten.
Okay, thank you, Ridhima. And I think we have just a few minutes left, and I think just now we actually reached the sort of well, let's call it the million-dollar question: will digital technologies actually help reduce the costs of verification? And I think that's a very difficult question, of course, to answer. But at least what we've learned today is we've heard some ideas about how verification could become more strategic in the future in order to support strategic purchasing in the different countries that we've talked about, Cameroon and Nigeria. And we've explored how digital technologies might be of use in making that possible in the future, in improving that verification process. So will it reduce costs? I don't think we have a final answer today yet, but that's a discussion, that's a debate to be continued. And I think what we've also learned today, and then I'm going back to the first presentation of the day, is that there's also another question to ask besides reducing costs. Also, is it improving value? Maybe in other ways, going beyond cost reduction, verification can improve value. I think what we've learned from Grégoire in different ways, but in order to measure value, and that's what I really took also from today, we need to first define what we actually expect from verification. What is the exact objective of verification? And as I already said earlier, that's maybe a question that is not always answered upfront. It's more of an iterative process where we find out over time what verification can do and how also that can be refined over time. And that's the process I think that also Faruk was referring to in the Nigeria experience. Over time, we find out that we make adaptations to a verification process, and that sometimes things are gained, but also sometimes things are lost over time, and we need to be flexible in order to also adjust the process again. With that being said, I think I will give the floor now to Mireille for the very last minute of this webinar, also to tell you a little bit about the way forward for this group.
Thank you, Maarten. Thank you, everyone. I think everything has been said, so I don't have much more to add, except that we are having another webinar, this one in French, in that series, where we will be presenting the Burkina Faso and Burundi experiences. And also, you will be, I'll be sending to you a questionnaire So can you please take some time to fill in? It will help to enhance the content. Thank you, everybody, and I wish you a good evening, a good afternoon, and a good day. Thank you.
Thank you, Mireille, and of course, a big thanks to all of the speakers that we had today, to Grégoire, to Valéry, to Faruk, and also thank you to Ridhima for her support in the Q&A process. So thank you very much, and see you next time.
Yeah. Thank you, guys.
Thank you.